My name is Sumohan Chatterjee. I'm a consultant oncoplastic breast surgeon working in the Manchester area. To become a doctor, oh gosh, that happened many years ago. I'm not sure. I was possibly inspired by my maternal side of the family. My maternal grandfather was a doctor. My uncle, aunties, a lot of them are doctors. I think that's where it came from. And being a surgeon, I think, was inspired by seeing people work as surgeons and the whole thing of you can do a real difference with your own hands and make people better. And that is where it all came from. So when I was a junior doctor training, there was nothing called breast cancer surgery specialty. This came in the mid 90s, and I guess I'm one of the first wave of trainees who decided to become breast surgeons. I got interested because my research area was in breast cancer. It was to do with sentinel nodes. So we were the first hospital in the whole country who published a big series of sentinel node biopsy when nobody knew anything about it. And at that time, breast cancer surgery was getting more interesting, not just lumpectomies and mastectomies. Interesting reconstruction work was coming in, and that made the surgical side more attractive. Plus, the breast cancer, there was a lot of research going into breast cancer. And although at that time the outcome from breast cancer treatment was not very good, we've been part of a generation who've seen an absolute shift in improving not only the outcome from breast cancer, but how we deal with it. So it's been a fascinating journey to be part of it for the last 25 years almost. Well, one is that you can make a real difference. There are a lot of cancers where the outcome is not very good, whereas in breast cancer, you can do something to improve lives, to make a real difference. And as you know, most of breast cancer treatment that we give now is for with curative intent. So patients, yes, they have a cancer diagnosis. However, we can do something so that they can survive the cancer and live a full life. And that is the most rewarding part of the work. When the patients come in, they're extremely worried, but if you speak to them 5 years later, when they're well, doing well, contributing fully to social and their personal lives, that makes it all worth it. I would say honesty, because one of the things to build up trust with patients is to be honest with them. There are times where you can give them a good answer, which they would like. However, there are difficult circumstances where you have to break a really difficult news to the patient, which will make them feel absolutely awful. However, the challenge is to deliver that in a way which can be done with empathy, be supportive, and also give a message of hope. But to do that, you have to earn the trust of the patient. And the best way to earn trust of the patient is honesty. I value the human interaction with the patients and the fact that we can build up that bond, and that bond is very precious. You often see patients for 5 minutes who you've never met before, and you give them possibly a life-changing diagnosis, and you advocate really difficult treatments that will affect them physically, emotionally, short term and long term. And the fact that they trust your personal and professional judgment makes me feel very privileged that I can be in a position to earn trust of who was a complete stranger 5 minutes ago, but then becomes your patient and you develop a long-term relationship. And that is very important. If the patient does not believe in what you are saying, then it will be very difficult for them to buy in to the treatment that you're advocating. And the most important thing I feel is never to pressurize anyone to take up a treatment option that you have said. And the aim always is to give patient options, give them the choices so that they can make a decision that is right for them. It is not for us to sit and say, okay, this is what we think is right for you. The patient has to think what is right for them. It is a shared decision-making process. I wouldn't say catchphrase, but the mantra always is to put the patient first. And to put the patient first, what I always try and do is to understand what their perception of what is going on. And if we can catch their perception and what is on their mind, that is the key to build that relationship. Because I may think that the patient is worried about the operation or the general anesthetic, whereas the patient may be more worried that the operation may impact on something important on their life, for example, a birthday or anniversary or something they may have planned before, and this treatment and the diagnosis comes at the wrong time. And they're more worried about upsetting their near and dear ones that they won't be able to maybe go to their daughter's wedding or something like that. So it's very important to understand what is bothering them most.